Okay, the next one is also related to deliberate practice, and this was, somebody was really upset with me because the super users were in a beta site where they started at the administrative level, and not all of the features were turned on. At the owner level, you may know, Scott, you can now customize you know, the name of your report as well as which reporting features you want to show. And so the patient dropouts. So on the aggregate stats page, I'm not going to bother going back to it because it's so small you can't see it. On the aggregate stats page, it now shows when why clients leave service, and also the dropout, your dropout rate. So the comment was, what happened to tracking patient dropouts? We were just getting ready to start tracking our patient dropout rates. This is one stat I was trying to figure out how to get clinicians working on from a deliberate practice improvement of skills focus. Without this stat, it really undermines understanding one's actual effectiveness. So how does looking at dropout rates, how does that affect your when you look at your pre-post effect size, for example, and how is that related to deliberate practice?
Well, let's talk about the effect size. I mean, the simplest way to think about this is if you really want to improve your effect size, well, then just terminate all your clients at 2 sessions. Because generally, simply by regression to the mean, you have a substantial amount of clients that improve between the first and the second session. The real challenge is to help people, of course, maintain that change. And we know that people, after they've experienced progress, as you can even see on most of these regression lines, the green line that you're showing, for example, right now, I would say was about 90% of the change in that graph happens by the 4th visit. After the 4th visit, as you can see, the green zone improves very little after that. But the critical piece here is that if you can keep clients a few more visits, the changes are by definition more durable. After all, you've seen them for a longer period of time. And so I would say that when clients drop out, for example, if this client dropped out at session 3, it would look like a success, when in fact the changes weren't maintained over time, and the change between sessions 2 and 3 on the graph were so abrupt, so large, that you would probably assume it had to do with something external rather than a change that resulting from the treatment, especially given the 2 prior sessions of relative lack of change. So what in terms of deliberate practice it means is taking the time to reflect on what you have to do to, number one, keep clients engaged for a little bit longer. And that means practicing having conversations with people who are at risk for dropping out. How do we know they're at risk for dropping out? Declining SRS scores is one example. Number 2, the rapid increase in ORS scores in the first handful of visits. So if you go from a 12 to a 28 or a 30, that client, believe it or not, is at a heightened risk for dropping out. After all, they feel so much better compared to where they started. And encouraging them to stay in care a little bit longer is one area, as I say, that we can spend some time thinking and deliberately practicing, and then notice whether or not what we do with the client in the room has an impact on our dropout rate. Did I get the question?
Yeah, no, that's good. That's good. Thanks, Scott.